welcome you all, and may I first acknowledge that certainly myself and the speakers that you'll be meeting in a moment, we're meeting on the land of the Kaurna people, and that we pay our respects to elders past, present and emerging, and acknowledge their ongoing strong relationship to the land. So thanks so much for joining us. So I'm really delighted to be presenting two of my most favourite colleagues. I have lots of favourites, but these two are pretty stunning. So our overall theme today is the work around nutrition and health at University of South Australia. I think I've forgotten to introduce myself. I've done this too many times. I'm Susan Hillier, the Dean for Research in Health and Human Performance here at University of South Australia, and always delighted to be part of the ABMC presentations. So our first speaker is Professor Alison Coates, who you may know as Ali. Ali is the director of our research centre here in ALH, in UniSA, and that centre is called ARENA, which looks at healthy living and healthy choices for healthy lives. So it has a remit around physical activity, nutrition, exercise, human performance, both for populations and for individuals. Ali's research is wide-reaching. She has our #1 collaborator, which is the US Board of Almond Growers or something like this. So that's about as amazing as you can get. But she collaborates with all sorts of industries around looking at diet and nutrition. So Ali, I'll leave it to you to take us through your work. Thank you.
Thanks very much, Susan. Today I'm going to be talking about a taste of nutrition research in ARENA at UniSA. I thought it was too much to try and cover everything we do within the research centre, and hopefully this gives you a bit of an idea of the breadth of research just in the work that I'm doing. So the first area I'm going to talk about today is with nuts, and looking at the work that we've done on diet quality, heart and brain health, as well as body composition. And we've been interested in looking at nuts because of their nutrient profile. So we know that they're a great source of good fats. They're rich in vasoactive amino acids, arginine. They have a range of healthy minerals. Naturally, they're low in sodium, although perhaps it's not the way that everyone enjoys eating them. But one of the reasons that we've been focusing on them is because of their polyphenol and carotenoid content. Now, this does differ based on the individual nut, but there's, as a whole, as a group, they have a really great profile. We've been working in this area for about the last 15 years, looking first of all at reviews on metabolic health, and then more recently looking at vascular health and cognition, nuts for cardiovascular disease prevention. And a recent review we've written has been looking at the evidence around nut consumption and health outcomes in children. And so we started working in this area because of an interest in different vasoactive nutrients and their ability to improve vascular function. We'd previously done work looking at pure resveratrol, and peanuts in particular were a source of resveratrol, which led us to investigate this. We're by no means the only people. There's good evidence that nut consumption is associated with improvements in vascular function. And we hypothesised that the nutrient profile in nuts may there go on to improve cognition through this improvement in vascular health. Now, it's not only through the vascular story that nuts have been associated with improvements in brain function. Population studies have shown that regular nut consumption is associated with better cognitive function, lower rates of cognitive decline, and lower risk of depression. And the mechanisms that have been proposed are associated with a number of the nutrients. It's way too much to go into today, but I have summarised the evidence in a fact sheet that I've developed for the tree nut industry in conjunction with Nuts for Life. There's also some health infographics that are pretty cool at their site if you want to have a look at any of those. So this area led us to work with the Peanut Company of Australia. This was part of an ARC linkage project that we ran. It was a 12-week crossover trial, so 24 weeks in total, 12 weeks each phase, where we worked with healthy, overweight older adults aged between 50 to 75, and we were interested in the higher oleic peanuts that are grown in Australia, and we provided them at a fairly high dose. It was 2 to 3 handfuls per day for women and for men. And we were interested in changes in cardiometabolic biomarkers as well as vascular function and cognition. So whilst we didn't see any changes in any of the cardiometabolic biomarkers, we did see an improvement in cerebrovascular responsiveness, which is a way of looking at changes in blood flow to the brain. This was also associated with improvements in short-term memory, better verbal fluency, as well as processing speed. And this was the first RCT to look at peanuts in this space. So it was pretty exciting to be involved in this. This work then led us on to work with the Almond Board of California, and we've run a 12-week parallel study using almonds compared with a nut-free diet. And in the nut-free diet, we provided snacks for people to consume that were matched on energy, that were higher in carbohydrate and had a different fat profile to what we see in nuts. In this particular trial, again, we were focused on cognition and cardiometabolic health biomarkers. We found improvements in triglycerides and systolic blood pressure, but no other changes in any of the cardiometabolic, mood or cognition markers we looked at. We then went on to look at changes in telomere length over this 12-week study, and that is a fairly short amount of time, but we were interested to see whether a fairly big dose of a particular food was able to shift telomeres within this amount of time, as there was some evidence from previous trials that this may be the case. We didn't see any changes, but we did see improvements in diet quality when nuts were incorporated into this diet. So we've got a couple of other ongoing studies with nuts at the moment. One is funded by the International Nut and Dried Fruit Council. So this has been a study that's been going for a few years. You can see the protocol's been published in 2017. And we have recruited nearly 100 trained male cyclists and triathletes, and we've been looking at a combination of almonds, sultanas and cranberries compared with an oat bar, and our primary outcome has been performance in this particular study. It's been a particularly challenging study to run during COVID, so we're delighted that we're now at the data analysis phase of this trial and hoping that we'll have data out early next year. The other trial is a 9-month weight loss intervention. So it's 3 months of weight loss followed by 6 months of weight maintenance. We're working with 134 participants who are either overweight or obese. You can see there's a fairly wide age range there, and we have a number of outcomes. Our primary outcome of interest is weight management. So we're looking at weight loss and weight regain. We're also interested in appetite regulation acutely and chronically. But then through the markers that we're able to also capture, we're looking at body fat distribution, energy expenditure in a number of different ways, including a subset of doubly labelled water, and you can see the other markers there. So I'm going to switch focus now and also talk about the second area that we've been interested in, which is timing of food and timing of sleep. And this work is being done in conjunction with the Behaviour, Brain and Body Research Centre here at UniSA. We've been interested in what happens when shift workers are eating and sleeping outside of their normal circadian rhythm. And so in this work, we've conducted a narrative review with a systematic search, looking at the factors that influence shift worker eating patterns, and it's been really interesting to look at what influences when, what, where and why people are choosing to eat and what they're choosing to eat. We've also conducted a couple of different field studies where we've looked at different dietary patterns between individuals on different shift types, and also how people's patterns change as they rotate across different shifts. Also worked with a great team at Monash University, looking at people who rotate through different shift types as well, and looking at how their eating occasions change when they're working nights compared to their days off. And in this particular data set, we were able to separate the data by type of industry that they worked in, and you can see that each individual dot is an eating occasion in blue, a caffeinated drink in red, and their shift length is indicated by the bar on the figure number 1 here. We're also able to see how they eat around the clock when they're eating, when they're working night shifts compared to working days. We've also got a really cool controlled laboratory here at UniSA, so we're able to conduct simulator shift work, and this has allowed us to look at a whole lot of different things in an NHMIC funded project where we've been looking at the distribution of energy and how if we change it to eating at night, snacking at night, or not eating at night, what happens in all of these outcome measures. So just to wrap up, we do have an ongoing large study also running in shift workers focused on Chrono Nutrition. So again, this is an NHMIC funded project that we're doing in conjunction with Monash Uni. It's an 18-month weight loss intervention, 6 months of weight loss followed by 12 months of weight maintenance. We're looking at habitual caloric restriction versus 2 intermittent fasting patterns, and we are at about the halfway point of this particular study. So lots still to go, lots of opportunities for collaboration in all of the trials that are ongoing at the moment. And with that, I'll finish. Thanks very much.
Great, thanks, Ali. Now I'll just jump into the chat room. If there's anybody's got any questions for Ali, we've got a minute or two. You can put them into the Q&A. You can type them in. I'll ask one while we're waiting. Everybody's always notoriously shy in these sessions about typing their questions in. So Ali, you've got some great studies going. Oh, Tim has said, how did the remaining diet change when nuts were added?
Yeah, it's a good question, Tim, and that was one of the reasons we were interested in looking at diet quality. So what we found is that in the first study when we looked at peanuts, we saw there was a shift in the non-core foods that people were eating. So their core foods remained good and their discretionary or non-core items reduced, which is exactly what we were hoping to see, so that people were exchanging those perhaps less good for you snacks with the nuts. And with the diet quality work that we've done with the almond study, we've looked more holistically rather than at individual foods. It's a composite score that's been developed. Sue Ward did this as her master's work. And so you get an overall score. And so we've seen that people are able to still achieve their core foods, but it gives you a global measure, which sometimes is easier to think about. So yeah, absolutely. It may not be nuts per se, but it could be displacement. And that is true of any dietary intervention. We're hoping that people are compensating for the food that they are being asked to eat. And I totally agree with you. We have to think of it as a whole diet rather than the individual magic bullet.
So I can displace lettuce with nuts or something like that, maybe.
Well, you could. There's a bit of an energy difference there, but and this is the thing, right? So both of them are great food. So we would hope that people are going to do it in moderation, in consultation. But think about, we know that nut consumption is really low in Australia. And so for those who aren't allergic, evidence to help them think about why it might be a good food to eat is always going to be helpful.
Great. Okay, look, thanks very much, Ali. Thank you for supplying your email. I know that Ali's really approachable. Please do reach out to her if you have any more questions. If you want to collaborate, if you want to participate in the studies. I watch people coming and going with their little bundles of goodies in the clinical trials facility here, so I know that they're always looking to recruit. So please do get involved if you're interested. Okay, so our next speaker, again on the theme of nutrition, is Dr. Evangeline Mantzioris. I'm really delighted to welcome Evangeline here. She's at University of South Australia in our Clinical and Health Sciences unit. Evangeline is also a program director for one of our really popular set of programs in teaching around nutrition and food sciences, and she'll talk to you a little bit more about that. She is a dietitian accredited and a sports dietitian, so you can ask her about energy drinks afterwards if you like. And she collaborates a lot with all the Adelaide teaching hospitals and in private practice. So I think you'll really enjoy listening. And the other thing you can ask Evangeline about is we're delighted to hear that she's been appointed to the committee by the NHMRC for the next lot of dietary guidelines. Those of you who are familiar with the dietary guidelines know that this is an amazing role that she'll be playing. It will really tax your intellect and your politics, and we really look forward to seeing the results of that work. So enough from me. Evangeline, thanks very much. If you want to start sharing your slides, I'll disappear.
Lovely. Thank you, Susan. So I'm going to have two aspects to my talk today, and the first is looking at the nutrition and food science degree that we have here at UniSA, and then looking a little bit at my own research with my research team, looking at the Mediterranean diet and chronic disease. So all about nutrition and food sciences at UniSA. The degree's been running here for many, many years. I started here about 13 years ago, and as the title says, it incorporates both nutrition and food science expertise. It's a competency-based degree, and we use the competencies from the Nutrition Society of Australia and the Australian Institute of Food and Science Technology. And because we're not an accredited degree, because there is no accreditation associated with those two associations, and competency-based, we're able to adapt our teaching rather quickly to new events that are happening in health, nutrition and food, and cover those. So the obvious one is looking at food security during COVID-19 and the implications of that across many, many sectors. If we look at our degree, we have a really strong foundation in basic and health sciences, covering the chemistry, the biology, the statistics. And this is much to the, the concern of our first year students who don't expect it to have this really heavy science focus. But we hold with that and we get our students through the first year. And then in the second year, they have a little bit of more of a health-focused science courses, such as physiology, biochemistry, and microbiology. The picture you can see here is our commercial grade kitchen that we've got up at City East, where students learn both a lot about food safety and food microbiology, because they obviously have to keep these premises really, really clean to commercial standard, but also about nutritional considerations and the food chemistry and how food is made. As they move into second and third year of the course, you can see that our courses are very specialised towards nutrition and food science. They do sensory and consumer analysis. And in fact, this photo that you can see on the screen is of a couple of the students in our sensory analysis lab. And you can see here, I'm not sure if you can see my pointer, but the green light that's emitting between the two ladies, that's the sensory space. And we have different coloured lights in there that change their colour and the appearance of the food so that people can make judgment about the food just based on taste and smell and not getting any of those visual cues. They also do food safety, food quality, food analysis. The students that specialise and do food science in their third year of their degree then go on to do food and product development. And as it would be in the, in the food industry, where they have to ensure a consistent and safe product with the appropriate marketing developments. They also do food fermentation. We've been doing that at UniSA for many, many years. We've been making kombucha, kimchi, all sorts of things before it became popular in the cafe society. And for those students that choose to do the nutrition specialisation in our degree, they do more nutritional physiology, requirements, communication skills, community nutrition, and then research skills and management. And the research skills and management culminate into what we call our Capstone Course at the end of the year. And this is why I'd like to talk about this a little bit more, is because, so I'll just go back to this slide, because this Capstone Course is where the students are able to develop all their skills, their research abilities, and how they manage research projects to go and do projects in the industry. And I'll show you some examples of that. As well as having this expertise combined with nutrition and food science, we're also really lucky that we've got double degrees with exercise and nutrition and food science and human movement and nutrition and food science. So it further expands the capability and the expertise of this student that they can work across a huge, wide area in health, where we know that the nutrition is just as important as the exercise, and these two can be combined. In these double degrees, the students do those specialised subjects from both degrees, and including studies in sports nutrition. So what are the requirements for physical activity, exercise and performance? And that forms a core course in these double degrees as well. So looking at our capstone course, which is in our third year course, I've just put up a selection of the types of projects that our students have done over the last year, and to demonstrate the range of abilities they bring to different ones. So at the Royal Adelaide Hospital, we've got a project that looked at assessing the evidence base for why neutropenic diets are being used in cancer patients, and also expanding it to doing microbiological testing to see how we can expand the dietary choice for these people. Taste Studios has used our students to develop better food products for children in retail spaces, and also in a little bit different one, assessing the nutritional properties of using high pressure processing to get fruit juices out. Whyalla Rural Health Placements, students have gone there and developed community nutrition resources, both in written and online resources for their clients. Second Bite, which is a food retrieval organisation, they're currently getting students to look at the cultural diversity of the meals that they provide. We also have links with the food industry, where they look at food design and improving the quality and the safety of the food. And this includes a range of craft brewers, which, as you can imagine, with everyone is really popular, as well as with different food manufacturers. Excuse me. And then our students have capabilities in clinical trials, like Alison has discussed, that are being run at ARENA, where they're able to prepare resources, measure, and also analyse nutritional and clinical outcomes that are needed in the studies. So really wide range of projects that our students can be involved in. And we're really happy to have more projects available to our students to expand their understanding of nutrition and food sciences in the real world. So moving on a little bit to some of the projects that I'm involved with various people across Australia. And this picture hopefully is all making you very hungry. And what it's trying to depict is the Mediterranean diet. And we've heard a lot about the Mediterranean diet at the moment. You could almost call it a fad diet in that it is very popular, but it is also backed by a lot of scientific research and evidence. And that evidence first came out in the 1950s and 1960s with the 7-country study, which looked at the diets of different countries around Europe and America to monitor diet and health outcomes. And what they found were countries, and specifically they were looking at the Cretan cohort, that the Cretan cohort had the lowest rate of heart disease, colon and breast cancer. And they also had the highest adult life expectancy rates in the world. And this was despite, and it was not linked at all with the educational level, the financial status, or the smoking rates or quality of the healthcare in Crete. And certainly in the 1950s and 60s, educational level was really low, financial status was quite critically poor, and smoking rates were amongst the highest in Europe, and they probably still are. Following on from that Mediterranean diet study and evidence that came from the 7-country study, the Lyon Diet Heart Study was done in the mid to late 80s, which showed us that they were able to prevent secondary rates of myocardial infarction in a population that was following a Mediterranean diet. And of course, at the time of publication, there was a lot of debate about whether this was actually possible, that you could prevent secondary heart disease. And the PREDIMED study, which was conducted in the 90s and the 2000s and still running at the moment, was able to show that adherence to a Mediterranean diet combined with either about a litre of olive oil a week or 30 grams of nuts 2 or 3 times a week, linked to Alison's study, was able to reduce the primary prevention of cardiovascular disease. So quite strong evidence. And since then, there has been a lot more evidence around cognitive benefits of Mediterranean diet, benefits for metabolic diseases like diabetes, as well as continuing the evidence for coronary heart disease. So one of the questions about the Mediterranean diet is, what is it? And I'm suspecting a lot of you, particularly about this time where you're thinking about what might be on for tea, is hoping that this might be the Mediterranean diet, a gyros with chips. Sadly, it's not, and I think we all know that it's not. And most of us might think it's something that looks like this. Nice, lean chicken breast with lots of nice vegetables and couscous there, so a good range of breads and cereals. But even in fact, this picture doesn't depict what the Mediterranean diet actually is. And this representation of it is perhaps the closest. A pretty well plant-based diet with minimal amounts of meat in it. And this picture shows a lentil soup here. So it's a plant food-based diet, high in fibre, monounsaturated fats, high in omega-3 fatty acids, polyphenols, and also antioxidants. And when we look at the diet more closely, we'll see that this is in fact what it entails. And I won't go through it all, but I just want to point out a couple of things. Really high plant food intake of fruit and vegetables and olive oil of about 80 mils a day, which people don't often realise that is the amount of oil that's in the diet. And that reflects all the dietary fat in their diet. The intake of meat is very minimal, maybe once or twice a week, if that, and then nuts and eggs making up the protein sources. So what we did was we thought, well, if the public have a poor conception of what the Mediterranean diet is, what is being used in research studies? And we know that the Mediterranean diet has been useful in type 2 diabetes, but what we wanted to see was what are the studies that have used the Mediterranean in type 2 diabetes actually recommending? And what we found was in these 9 RCTs that we found, there was a large variation in the interpretation of the med diet, and the majority of the studies didn't provide any advice on the type or the variety of vegetables consumed, and in some cases provided no advice on fruit, legumes, nuts, bread, red wine, and fermentable dairy products. They also gave no information on description of cooking methods. All of them mentioned these, but once again, there wasn't that great detail that we know that the Mediterranean diet is. We next had a look to see could Australians follow the Mediterranean diet and looked at the evidence base again. And once again, from 8 RCTs in the last 10 years of between 12 to 24 weeks, there were 8 RCTs, all done in different study groups, type 2 diabetes, cardiovascular disease, non-alcoholic liver disease. And what we saw there was we saw favourable outcomes, but once again, the strategies there was good adherence, but the strategies they used to promote adherence were actually very intensive. So all of them used dietitians, written resources, cooking guidance, videos, cookbooks, and also supplied foods or meals. So quite intensive ways of trying to get people to promote to adherence. So we did a study looking at what people actually felt about the Mediterranean diet and why it may be difficult to follow it. And we had 606 responses, mostly women, young to middle age, with a small percentage having health qualification. And whilst they perceived that the Mediterranean would give them health benefits, there were many, many barriers, including the suitability of the foods in our country, that it was restrictive, it was seen as being very culturally different, and the affordability, food access, and knowledge around preparation was also problematic. So what we've done is brought all this research together to run, we've got a couple of trials running at the moment across Australia, where our primary outcomes are looking at clinical outcomes, but our secondary outcomes are looking at the feasibility of using this diet in these clinical groups. And just to give an oversight of the projects we have going on at the moment, and with all the team members, looking at polycystic ovary syndrome, and also next year will be subfertile couples, and seeing how the Mediterranean diet can help there. We're also hoping to do a study with diabetes and Mediterranean diet next year at UniSA, where we're going to be particularly looking at advanced glycation end products. And Susan, I don't know if I have a chance to describe what the advanced glycation end products are, but really, really quickly, it's when lipids and proteins in our body are glycated due to the increased level of blood glucose levels. And these are linked to progressive worsening of degenerative diseases, such as heart disease, diabetes, Alzheimer's. And they increase in our body as we age, but they are also created in our body when we consume foods that have been heavily processed, or they've been browned or caramelized. And these roast potatoes are an example of caramelization. And what we know from the Mediterranean diet is they're traditionally slow cooked meals. So this might provide an additional benefit in using the Mediterranean diet and its cooking methods in people with diabetes. So we're really excited about hopefully being able to get this trial started, providing we get the funding we've been looking for. I'll end there. Sorry to go over time.
Thanks very much, Evangeline. That's fantastic. I always do get a bit confused about Mediterranean diet because I tend to think it's, all pickled squid and lettuce or something. But anyway, I know about olive oil for sure. Do you recommend people drink it, or how do you get that much olive oil into you?
Yeah, it's an interesting question, isn't it? Because if you look at the standard Western diet, you consume about 60 to 80 grams of fat. But as you can see, all the other foods they consume don't have any fats in them. So their prime oil is the olive oil. And if you look at the traditional methods of cooking, it's, cooking vegetables, greens, all in olive oil. And quite a bit is used during the process. Also, there was no butter or margarine. So olive oil is used on bread as well.
I'm
so
not sure.
Mils,
Yes, 80 mils. Okay, we'll try.
Yes, we'll try.
Okay. I know Evangeline is also incredibly approachable. She's a great communicator, and you'll read a lot about her work in the conversation and things like that. She's really passionate about communicating good diets, as is Ali. So please do get in touch with them. Thank you so much for joining us today, and we hope that people will also tap into the recording. So thanks, Evangeline. Thanks, Ali.
Thank you.
Now I'm going to have to go home and think about what I'm going to have for dinner. I
As
guess
we
not
all
to,
are.
not take away. Okay. Thanks, everybody.
Thank you. Bye.
Bye-bye.